Hello everyone, I am Dr. Beatrice Hippolyte and this is your world. Today we have the pleasure to have as our guest speaker Mr. Marc Bonhomme. Mr. Marc Bonhomme is a friend, is a colleague, is a mentor, help me out, Mr. B.
I have an extensive background in case management. I've worked with underserved populations in both capacity of teacher as well as case management, as I mentioned. And, I'm just here and just honored to be your guest, Doctor.
Today I'm glad to have you and welcome to the show.
Thank you. Thank you. And today we're going to discuss co-occurring disorders. And Dr. Hippolyte, who has more experience than me, has had background working with mental health, people with mental health diagnoses, and oftentimes in the past this was referred to as MICA or mentally ill chemical abuser, which is no longer the term now. Now the preferred term is co-occurring disorders. So we're here to discuss that and how this impacts the community and ways that we can deal with some of these issues.
Okay? So it's like, but one thing we're not gonna focus on, we're gonna address it, but not to really consider the clinical aspect of it.
Yes, in other words, we're going to keep it in layman language, okay, so that the average person can understand. We don't want to get too clinical. We just want to make it relatable and just something to share with the community so we can all discuss and get something out of it, hopefully.
Okay, let's get going. What you have for us?
Okay, well, just to share with you, this is a subject that I am passionate about since unfortunately I have a family background of it. With both mental health issues as well as chemical addiction. And so this is something that I've been passionate about, and so I have a background working with individuals in the community. I've done case management for individuals working in living in supportive housing and other settings, and it's been very challenging in some ways. I've had some individuals that have some very, very profound issues. Some of the outcomes have not been the best, and so this is a subject that I remain passionate about, and hope that I can be of service to you, and and with some of what I have to say on this program.
Okay, so what do you know about co-occurring disorder?
Well, from what I understand, oftentimes depression and substance use are often co-occur, with like 30% of individuals with depression also experiencing some substance use disorder. Quite often anxiety disorders, depression, typically a mental health issue, often frequently co-occur, with approximately 60% of individuals with depression also experiencing anxiety disorder. There's also trauma, like if you have a family history of trauma, depression often occurs with trauma-related disorders such as post-traumatic stress disorder. Approximately 50% of individuals with PTSD also experience depression. And really, I think what it comes down to is getting to the root of the issue, which is often a mental health diagnosis, and how that can be addressed to better, more effectively deal with the chemical dependency piece. Also, increased risk of co-occurring disorders, increased risk of worsening symptoms, treatment resistance, relapse, and quite often with some of the individuals that I've worked with, they have, chronic relapse cycles. Sometimes they seem like they're doing very well, and then suddenly out of nowhere, you'll see them relapsing. And unfortunately, there are situations where you have individuals that even come down with suicidal thoughts, or suicidal ideation, and we want to curb that as much as possible. One thing that we want to do is adopt a holistic approach and look at individuals as being components of various parts, various elements. And so this is why integrated care is something that's really important. Treating co-occurring disorders, depression together is basically crucial, and effective management and helps improves outcomes, okay?
Have you ever directly worked with people with co-occurring disorder? or depression and alcohol or drug use or abuse?
Yes, I have. And I'll be honest with you, in the beginning, it was a bit frustrating. Some of the individuals that I work with, I didn't even feel safe around because I felt like they were constantly scheming and looking for ways of getting over and really not even seeing me as a person as much as they would just see me as a vehicle to get whatever they wanted. So it always felt very awkward engaging them. And I used to refer to their way of engagement as stinking thinking. Okay, where we like the individual's always looking for a way to kind of get over on someone. So I learned to look past that, and I learned to understand that this is a clinical condition. And when you look at it from that perspective, you depersonalize it and understand that this is someone who's dealing with these disorders, and you just have to look at it that way and just separate that from the person.
Okay, so
Okay.
and in situation like that, since I understand it's not really your area of expertise, so what you normally do, what you normally do in terms of providing like a more consistent assistance to those individuals.
Well, one thing that I do is when I engage the individuals, I always make sure that when addressing the problem, that I don't make the problem and the individual synonymous. Okay, and that's very important. And it comes back to what I said earlier about depersonalizing. This is something that is separate from them. This is something that, even though it's something that they're grappling with, you don't want to make it synonymous with the individual.
Okay, but
Yeah.
in that setting that you used to work, so is there any mental health providers or clinicians or any professional in that area that you used to work
Yes,
that you could have
actually,
referred those clients to?
of course. Actually, in my background, as far as case management goes, I've worked with various mental health providers. I've made referrals. One thing that I've done with my individuals is I've consistently stayed on top of them in terms of keeping their appointments and keeping their commitments. For example, if someone says, I'm going to do something, you want to hold them to that, hold them to their word. And so this is something that I've done with my individuals. And I think that when I approach them with that consistency, because a lot of them just lack consistency and they need structure, it's really important and it goes a long way.
Okay, very important.
Yeah.
And I also understand that with COVID, we have according to research, there is a 25% increase, of mental health situation going on, and it's throughout the world.
Of course, and it doesn't surprise. I mean, if you have individuals that are holed up in an apartment all day and they can't go anywhere, especially if they're dealing with these issues, chances are it's going to worsen. Human beings, we are social animals. We crave being, in contact with each other. It's so vital that we get, utilize opportunities to be together. When you have a situation where people can't socialize, where they can't leave their apartment, you're only going to have problems. Okay, so it doesn't surprise me that since the lockdown,
And in situation like that, oftentimes people don't really know how to deal with it.
Absolutely.
And so the best way, to many to deal with is to kind of like plunge themselves into whatever substance that may be, either like weed, cocaine,
That's right.
crack,
Crack,
or
cocaine.
heavy alcohol. So it's like many people that I've worked with in the past, claim that, oh, you know what, so when I drank, despite knowing that I have a mental health problem going on, but when I drank, so that kind of helped me to forget about my situation.
Absolutely,
So
absolutely.
what do you think about that? You think that's really helping somebody forget about the situation when they drink?
Of course
or
not.
do drugs?
Of course not. It's basically just a temporary solution, if you want to call it that. But it's really just a temporary fix, but it doesn't address the underlying issue. One thing that I like to do with my individuals is get to the root, talk about what it is that they're dealing with, and just say, you know what? Let's not talk about the drugs or how you're coping. Let's talk about dealing with that issue. What steps can we do to fix that problem? And I think that once that happens and you redirect their focus to addressing the issue, then you can have some progress.
Yeah, because I've worked with people in the past, who claim that, Missy Polit, I know I've been dealing with depression or anxiety or any type of other mental problem, but for whatever reason, I cannot stop doing drugs.
Yes, yes.
And a patient like that, it's hard to really assist them even when you refer them to the mental health department.
That's right.
So, all you're gonna be hearing, so it's not really the problem, the mental problem, it's more like the drugs, component of
Component,
it.
exactly.
It's a challenge.
Yes, and unfortunately, oftentimes the way healthcare is structured, usually you just have specialists working in those particular areas, but it's hard for them to actually work together, okay, where they're both on the same page. And that's why integrated health or holistic health is really a better way to go, because you're looking at the person and all their parts and you want to make sure everything is coming together.
But Mr. Bonhomme, do you
Yeah.
feel that, I know, like, so you love working with young black men.
Yes.
That's something that
That's my target population.
you passionate
Yeah.
about. So before I even ask the question that I wanted to ask, let me inquire the reason why you are so passionate about working with young black men.
Well, one reason is that I'm a black man myself, and I come from an underserved community, and I have seen a lot of things that I just found were very unsettling. I see a lot of young brothers, unfortunately, become statistics, and I wanted to do something about that. I didn't just want to be idle and sit back and continue to watch that. One thing I've seen quite often is a serious mental health crisis happening with black men, particularly in the communities that are underserved. I oftentimes will find myself riding public transportation or being in the community, and I'll see a black man on the street having a psychotic episode. And people are treating this like it's just background noise. And I say, no, this is a real problem and we need to address it. We look at crime stats and we look at what's going on with random violence and things like that. Let's deal with the fact that we have a very serious mental health crisis in our community, especially pertaining to black men. And I think that more services and more attention needs to be put on it.
I agree with you on that 100%.
Yes.
And so it's like working with those black men or individual who suffer a co-occurring disorder with co-occurring disorder.
Mm-hmm.
So what you will you consider like the most challenging aspect while working with them?
I like that question. One thing is that unfortunately we have there are a lot of I would say acquired habits and behaviors that are sometimes very hard to unlearn, especially if these are behaviors that have been passed on from generation to generation. A lot of some of these behaviors can actually be traced back to even slavery. And so I think what it comes down to is really just focusing on unlearning those behaviors or replacing poor habits with good habits.
So you mentioned that some of those behaviors can be can go back,
Be traced back to slavery.
To
yes.
slavery. In what way, and why you think,
Okay, like for example, there's a lot of internalized self-hatred. Oftentimes, men of color, we tend to not feel that we're deserving or that we're adequate or we're not good enough, and so we internalize these beliefs. And oftentimes this leads to self-destructive behaviors. Not only self-destructive behaviors, but oppressive behaviors where we even keep one another down. So you might see another black man who's doing his thing and you become envious, or you think, oh, well, who does he think he is? And you feel this need to put him in his place because you've internalized this idea that people that look like you aren't supposed to be successful.
Because you were taught that way.
Absolutely. So what I'm here to do is to say that it's time that we unlearn these habits, unlearn these behaviors so that we can become the best version of ourselves.
But it's so amazing that you mentioned that.
Mm-hmm.
One thing that I also noticed, like in black people or young black people, if I may say it that way, oftentimes, it's like they tend to not only have the urge to seek help, but they tend to kind of like internalize everything, making believe that, oh, you know what, so I'm a man.
That's right.
So it's like, because I'm a man, so I should not have feelings.
Right, right, right. And that's I like that you touched on that because quite often when it comes to emotion, men are taught to suppress, even deny our emotions, which is not healthy. But I also don't believe that men should just allow their emotions to run amok. I think what it comes down to is having the ability to be in the moment, of course, being in the moment, feeling the emotion, acknowledging the emotion, but at the same time allowing the rational mind to have the final say and not the emotion. The emotion should not overwhelm you. A master once said, emotions make great servants, but poor masters.
Poor masters.
Okay, so it's really important that it's okay to acknowledge and feel the emotion. Okay, I'm feeling tense, I'm feeling angry, but the emotion will not have the final say. My rational mind will.
I agree with that, but
Yes.
so it's like it's many too often. So we
Mm-hmm.
hold on that mentality, or so you get your in situation where society said, oh, men don't cry, men don't complain, men don't, so come on. So at the end of the day, beside being
That's right.
a man, you are a human being,
Of course you are.
with
Of course you
feelings,
are.
emotions, and everything. So it's like, so if you feel that you have a need to cry, cry. And I will agree with you when you said, not to, and like to focus more on the crying. Don't waste your entire day or week or month or life crying.
Right.
So it's like you
Be
feel like
proactive.
crying for that moment, cry. But at the end of the day, what you gonna be doing,
That's right.
about the situation that make you feel
That way.
that
Exactly.
way.
Exactly. And so one thing that I like to do is in terms of dealing with difficulty and dealing with difficult feelings, finding outlets, finding things that you like to do that are constructive. I mean, even if it's going to a gym and punching a bag or working out, all these things are great ways of relieving stress and great ways of managing your emotions, because instead of doing something destructive, you're finding something constructive to do. Working out, for example, is very good for your body. It increases your circulation and there's so many
Clear off
benefits.
your mind too.
Absolutely, and it's a huge de-stressor. So, when I deal with my individuals, I always encourage them to work out, to take walks, do things that involve physical activity, and do things they enjoy. That includes hobbies. For example, if you like to paint, or if you like to draw, or if you even like to listen to music, that can be a great outlet for you.
Yeah,
Okay? In terms of managing emotions, difficult emotions.
very important.
Yes.
But so I know that you like to focus on young black men. So what about like young black women or women in general? So I understand working with black men
Of
may be
course.
your preference.
Of course.
But what about if you get in a situation where you encounter some black women who dealing with the same issue and need assistance? So what will be your move in that situation?
Well, of course, in that situation, while I would do my best to address whatever their concerns or issues are, I would then, of course, refer those individuals to maybe a female care provider or someone who is more competent in that area.
Okay. So it's like, but one thing that you're gonna make sure that you do is to be of assistance.
Of course.
At that moment.
Absolutely. At that moment.
Very
Absolutely.
important.
Yes.
Because sometimes you have a lot of people out there who have situations that require direct assistance, but oftentimes they
It's
don't
not
know.
there. That's right.
Not only the assistant may not be there, but even when the assistance is there, many people tend not to know where to go.
That's right. And also, we have to address that there's often a stigma associated with seeking help, especially with mental health, particularly in communities of color. There's this idea that, if you go to a psychiatrist or you see a mental health provider, that you're crazy. No, you're not crazy. You're just someone who needs help. That's all. And we have to understand it from that perspective, because we have to remove this this negative stigma that somehow seeking help from a mental health professional is bad. So we have to get over that.
Yeah, and especially in the Caribbean community, we see that a lot.
Yes.
My community, including, so it's like Asian people,
they don't get help.
So it's like it always has to do something that has to do with bad spirit or voodoo, you done something to somebody,
Right,
and
right, right.
eventually that person put a curse on you. So it's like, and many oftentimes, I may say, so you see that the person, has a need for urgent help, but because, it's like sometimes it's hard to kind of walk toward that belief,
Yes,
and to really help them switch
absolutely.
and get the help
Help
that
they
they
need.
need.
Right, right.
So it's a serious challenge.
Yes, so it kind of goes back to what I was saying before about unlearning ways, unlearning bad habits and replacing them with better ones, okay? Being more rational, and looking at these issues from a more rational point of view,
What of you?
okay? All right, so let's see.
Now, it's like, I understand, so we're not being clinical about this. So, but in terms of treatments, there are many type
Treatments
of
available.
treatments, available around here. But therapy, so considered to be
Yes.
one of them.
Well, I highly recommend therapy, and I have benefited personally from therapy. Fortunately, I had a clinician years ago who I had a very good relationship with, and I encourage everyone to do it. At least everyone, I think, should have therapy at least at some point in their lives. I think that there are benefits to it. One thing that's great about therapy is that it really helps you get to know yourself, and what some of your real issues are, and the work that you really need to do, and to change your situation.
Not only to really know yourself, but it's also help you to gain insight about the actual problem that you are dealing with. Because way too often I've seen people dealing with serious situation, but don't even know that the problem is serious.
That's
But
right.
if you get to make it to therapy and sit with that professional that will kind of break down things into pieces and
I
let
agree.
you understand, like the way that you're supposed to. So that treatment that you've been resisted for so long, now you will be much easier to embrace it.
That's
because
right.
you understand exactly
Right.
what you are dealing with.
Right.
But when we don't have no knowledge, no insight about what's really going on, so it's that treatment it's will be hard for
Right.
you to embrace.
That's right. And then you're going through life not even knowing you have a problem.
Yeah, exactly. And family and social support.
Yeah, I can't stress that enough.
It's very important.
I put a very high premium on that. That's something that's invaluable. It's so important that you have someone in your corner, even if it's just one person. And I have a saying about friends. It's not really about quantity, but all about quality. Okay, I'd much rather have 2 quarters than 50 pennies. And so when you have people in your corner, people that support you, it can really go a long way. Because if you feel like you're having a rough day, or if they even notice something is off about you, you have someone there to support you, and that really means a lot.
It's like, if I know that, okay, I've known Mr. Bonhomme for a while now, and I know he's not a type who normally go to bed at 6 or 7, and it's been like 3-4 days I've been calling, and he's always in bed at 6 or 7. Something is not right.
Yes,
So
yeah,
I have to check that out.
Absolutely.
And so even go to, hey, Mr. B, so that's not you. What's going on?
Yes.
Let's talk about it.
Yes.
So, or do you want to talk about it? Because as much as I want to help, but one thing that is very vital, you have to respect privacy.
Of course. Of course.
So it's like, you want to be of assistance, but make sure the person wants to talk about this situation.
That's right.
Because I can be there to help you. I can be there for you to lean your head on my shoulder, but I have to give you space.
Right. And that's something that's very delicate. That's something very delicate, because you want to offer help, but at the same time you don't want to browbeat, and you don't want to come off as imposing, because that's just going to scare people away.
Because exactly, you don't want that, because while you're trying to help and the person is drifting away from you. So not only you may lose a friendship over you being too imposing or bossy,
Right.
or you may and the person may end up losing himself or herself because you didn't know how to address or approach the person appropriately.
Absolutely.
Very important.
Yeah.
So you want to be of assistance to your friends and family member, but also understand that, hey, they have a private life, and it's important, it's vital to show respect to anybody
Absolutely.
that you want to assist.
In other words, boundaries. You have to respect those boundaries.
Yeah, exactly.
Yes.
Exactly.
Of course.
So it's like, if I don't open the door for you, so you cannot decide to step foot in. So,
That's right.
or, uninvited.
Yes.
So you want to assist, but hey, so I can have limitation to what degree that I need your assistance.
Absolutely.
And it's no point for you to get upset and think that, oh, I don't consider you as a friend, or I'm pushing you away.
Yes.
So because it's like we all are different. Some people may have the need and be willing and open, to embrace the help that you may bring on the table. Some people may decide on how to get the assistance you want to offer.
Right.
So, and one thing that you mentioned earlier, so it's like, get socially more involved. Take some time for yourself. Take me day, or me time, like
Me
people
time,
normally
right,
say.
right. Yes. Yes.
So, and so it's like, and I admire that from you from time to time. So you say, you know what? I need a mental day,
Mental health day,
a
yes.
mental health day from work. So not because you don't like to work or you're lazy or what have you. You have those vacation day
Right.
time.
Use them.
So use them.
That's right.
So it's like you have personal time. Use them. So it's like some people may be working and they tend to be overwhelmed. So while they could have used 1 or 2 days of relaxation. So it's like take times off from work. So it's like for those who can go, to a spa, just to go to the park and enjoy some ice cream from the ice cream shop.
Right.
So take time to go and have a nice haircut.
Right.
Or a nice hairdo.
Yes.
So take times, to
or sit on the beach.
Sit
right?
on the beach.
Right.
Or if you have kids, just go take a long walk in the park.
Absolutely.
Do whatever, because everybody financial situation is different.
That's right.
So it's like some people may be able to go and enjoy a Broadway show. Someone they can go to out for a movie. Some can go to a nice fancy restaurant. Some can only go to McDonald's or BBQ.
That's right.
Whatever that you are capable of doing, or you can afford of doing. But the most important thing, you have to take care of yourself.
Absolutely.
It's a must. You have to take care of yourself, because the body, so it's like it's a whole. So the same way, you diabetes, you have high blood pressure, or you may have any other health condition going on, and you're gonna make sure that you go to the doctor and taking care of that. Mental, your mental is important.
Absolutely.
Because what they always says about the head.
That's right.
That's right. There is a slogan about the head. So the body cannot function or sustain without the head.
That's right.
So if it is true, then let's go out there and take care of our head.
Amen to that. Amen to that.
Relapse, so prevention. So you want to tap on that?
Yes. I've dealt with individuals that unfortunately have had chronic histories of relapsing. And one thing you have to do as a provider is not take it personally. Sometimes what happens is you have so much hope and faith that this individual is going to get well and going to get better, and then they relapse and they keep disappointing you. And then what happens is you find yourself sometimes interjecting your own personal feelings into that. You don't want that to happen. You just say, okay, this is just another stumbling block, all right? And I'm just going to continue to work with this individual. That's how you have to look at it. Disconnect your feelings from it. Don't make it personal. I mean, like I said, you might have had high hopes for that person, but don't look at it as a disappointment. And don't project that onto the care that you're providing for the person.
You know what? You just nailed it right,
On the head.
On the head. We have to be patient. We have to understand where the patient, is coming from. Like in social work, they have that, that powerful statement. You meet the client where he or she's at.
Meet them where they
You
are.
know?
That's right.
So-
and one thing that's very powerful, and this is very significant, is you celebrate and applaud even small victories or small steps. Okay,
Yeah.
that goes a long way.
Yeah, because
Yeah.
it varies.
Yes.
Every individual is different.
Mm-hmm.
While you'll be working with this client or that client, it may take that client 6 months, to achieve the treatment
Or 6
plan or
years.
the treatment goals.
Yeah.
But some clients, it may take them 6 months or 6 years or even more.
That's right.
So it's like, and I agree to what you just said. Be patient.
That's
Don't
right.
take it personal, because at the end of the day, so some people can be quick. Some people they're like, oh, you know what, I've tried, but something happened. We
Right.
deal with pressure differently.
That's
So
right. And as a provider, as a care provider, it's not your role to put a time limit on treatment.
Definitely,
your
because at then, as a provider or therapist or whatever your title may be, so a mentor, a coach, always remember the treatment is your client treatment.
That's
It's
right.
not your treatment.
That's right.
It's not
Absolutely.
your treatment. Sometimes you may have somebody come and walk while you're working with that person. So don't make believe that, oh, I have this plan, lay out for that person. As a matter of fact, you should not be making a plan for the client. So we
Yes,
are making
yes.
the plan together. Let the client be the master of his or her life.
Right. In other words, you're assigning them agency, because that's ultimately what we want to do. We want to give them control, because oftentimes there's this feeling of not having control, a lack of control, and this is thus the problem. So we want to give them agency, empower them, so that they can believe that they can do something about their condition.
Exactly.
Yes.
Exactly. Because it's like, while you may force some changes in that person's life, if the person is not ready, it's not gonna happen.
Yes.
The person has to be ready to embrace and accept changes.
Yes.
Because it's written.
Absolutely. Absolutely.
Mr. B, that was a great moment. That was a great show. I
Yes.
enjoyed, and I'm assuming that everybody who's listening or watching now is gonna enjoy it as well. So thank you so much for your time.
And thank you for
It was a
having me.
pleasure it was a pleasure having you.
Yes, it was an honor being your guest. Thank you, Dr.
Thank you so much.
Okay.
I'll see you next time.
Yes, see you. Take care, people.
See you another time.